Hi, my name is Nicole, and I am documenting my infertility process. Today was appointment day one. What we did today was to draw blood. I already had some blood work drawn before, which was very helpful because I drew a FSH level, and it was many more labs to be drawn to consider pregnancy. But one level I did not have was my AMH level, and what that does, it tells you how many eggs that a female potentially have to get pregnant. Also, that level also shows if a woman as she gets older, the levels declined. So I'm not going to tell you my age. I am between 35, 45 years of age. Me and my husband been together for 10 years and married for 4, and we have not yet conceived. I'm not saying that we wasn't trying, but no protection was used. But hey, things happen. So we are at step 1, which I told you before, to get those levels back. And then on Monday, I will draw progesterone 21. And that also tells me when I'm ovulating. I'm thinking my thing about me is that, before I get into that, I have PCOS. Well, I have the rare case of PCOS. PCOS is polycystic ovarian syndrome. Well, some girls' symptoms are skip cycles or abnormal hair growth, insulin resistant, and things of that nature. Well, I am the rarest one of all. My cycles are normal. I do not have abnormal hair growth. My labs are normal besides the 2 I just mentioned before. I don't know those labs. But the only thing about me that sets me in that category is I have the polycystic ovaries. Polycystic ovaries is that your ovaries form more ovaries than the normal person does. I'm thinking that's right. And there's no eggs in there. So I have had a total of 4 laparoscopic surgeries due to that, because with my cysts, they're supposed to rupture on their own, but mine just continue to grow. And so my biggest cyst range from 6 to 7 centimeters, which is very huge on a small little ovary. So I have had like 4 surgeries due to polycystic syndrome. So that's what put me in the category of PCOS. I'm very hopeful. I know that God has the last say so, but I know God also put people on this earth and give them a talent to help people. So I decided to get over the fear of not having a positive test and just break down and just go back to a GYN. I previously seen a GYN before, and I did the HSG, and that's when they put dye in your tubes to see if your tubes are open. Well, come to find out, I had a hydrosalpinx on my right tube, which is fluid in the tube. So the left side did spill, and what you do want spillage. So my left side did have some spillage, but my right side didn't. But we also found that I had hydrosalpinx, so again, another surgery. Upon that surgery, he found like a growth on my tube. So he removed the growth, and also by removing that growth, I'm thinking that area was the growth instead of the hydrosalpinx. But he tried to save my tube, so there's a higher possibility of me getting pregnant. Now, therefore, by that being said, you can only have 1 tube and get pregnant. The thing about that is some girls you ovulate on different sides, and you know, some girls, that's how ovulation works. You may just ovulate on one ovary and not the other. When we did that, they put me on Clomid, which was awful for me because it made me into a person that I was not. So I was like, I don't want to go that route because I do not like to take anything that's going to alter me, and it really altered me, made me into a bad person. So that's where the cutoff was at, and that was like in 2016. So what really made me try again, 6 years later, is that I didn't want to give up. I want to say at least I tried. So here is me trying. My husband, he is very patient. Fast forward, we're waiting on these labs to come back, and the doctor is going to call instead of an appointment, which is good for me because I am a GYN nurse, so it's kind of hard for me to just take off. But she said that she will give me a call once she gets all the lab work in. Now, the lab, the AMH lab, is called the anti-Mullerian hormone, and also I have to do the 21 progesterone. So I did that lab, the AMH lab, today, and on Monday I would do the progesterone 21, and then she would give me a call, and then we'll see if all the labs are normal, and we will probably start with medication. Now, as far as my husband, he will get a semen analysis, and he's not happy about that. But he is trusting the process, knowing that, you know, this has to happen. So he's not okay with that, but he's going to be okay with it. And then we'll go from there. I feel like documenting this is because I know there are women out there that have issues with infertility, and I want to support that group of women as much as I can. Me, as working in the GYN field, I've seen the ups and downs, and you know, I think that's the reason why I did not want to go back after 2016. I stopped because I've too personally had to tell a girl that, you know, you have ovarian failure, and for me to tell women that, and then, you know, me trying to get pregnant at that time, it was just too much for me. So I backed away, and I was like, Lord, you know, if your will be done, I will get pregnant. Well, 6 years later, we still didn't have no babies, so I decided to just make an appointment with a GYN, and I told her my issues that I was having. She is bomb.com. I cannot release the name because I have not gotten her permission, but she is bomb.com. I prayed to God when I had this appointment. I wanted a woman because women, I feel like, are more sincere. I'm not saying a man doctor is not as sincere, because, you know, you do have some sweet men doctors. But I wanted a woman doctor, and I wanted a woman to be real with me. So me going in, I knew that my age was the one factor that was going to play a part. And she was just straight up with me. She was like, now, the only factor that is, you know, really, really crucial is your age. And I knew that going in, but for her to say it, I was like, God, I hear you, because that's what I prayed. I wanted someone to be up front with me. I wanted someone not to beat around the bush, or I wanted someone to say, hey, we don't need to try medication. We got to do IVF. And that too is going to be a whole different story too. But I liked her. She was very, very pleasant. And she was just straight up, and she was like, I'm just going to go ahead and tell you, your age is one factor. And as we get older, you know, your egg count does drop. She said, but we just have to make sure where we're at right now. And once we get these labs back and the semen analysis back, and then we'll go from there. Which I thought it was a great, great visit, because she answered all my questions. I knew, as me working as a GYN nurse since 2006. I knew my stuff. You know, I researched my stuff. I lived in it. You know, I worked in it. So I really knew. I think I needed to hear it out loud about my age. And I was like, okay, God, because that's what I asked for. I wanted someone real, and I wanted a female. And she's a new doctor, so fresh ears. I know, being fresh out of doctor school, I know that she's gonna have my best interest at heart, and just don't, you know, just like, well, you know, you can't get pregnant, then, you know, other options. But you know, at least she's showing me that she's trying. But she also gave me what was real in my age. It is real, because when you turn 35, your chances of getting pregnant or your egg count declines. Now, I've seen personally people getting pregnant in their 50s. So hey, you know, it just depends on the girl. But by me coming on sharing my story, I just want to help other women, just to build up encouragement and trusting in God foremost, because God is the reason for everything we do. So I just wanted to start a little documentary on my infertility. So baby does this way. I hope my numbers will be fine, normal, and we can just start this process. Thanks.